It's 4:30 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and we're now bringing you the latest live briefing from the South Korean health authorities. We should be getting a breakdown of the latest case numbers, as well as any trends and possible updates on virus precautions being taken. Also, the latest on the vaccine campaign in South Korea. That briefing should start in just a moment. We do know that South Korea reported 416 new cases of COVID-19 on Sunday, which was almost the same number as the previous day, though it should be said fewer cases are conducted on the weekend. It looks like the briefing is going to start now. Let's go and take a listen.
And we will be providing sign language translation. First, we will hear from the overall officer of disinfection, Yoon Tae-oh, on the developments for COVID-19. It is March 7th, Sunday, and I'll start the regular briefing for today. As of midnight of today, there were 399 newly confirmed cases, and there were 17 imported cases. 2 people passed away yesterday. We pay our respect to the deceased, and we pay our condolences to the family members. Starting from February 28th to March 6th, there were developments made, and I will update you on the cases of newly confirmed cases. For the past week, there were 372 newly confirmed cases on a daily average, and compared to 392 from the previous week, it is at a similar level. For the metropolitan area, there are still many newly confirmed cases, and we do not see a decrease in the trend. We have seen around 299 newly confirmed cases on a daily average for the metropolitan area, and this was around 80%. And for the non-metropolitan area, it was around 70, which was less than 800. And for each of the regions, we saw that there were no regions that exceeded 30 newly confirmed cases at a daily average. This means that for the metropolitan area, it is quite risky because resurgence can happen at any time. So we want to ask the residents of the metropolitan area to consider this and make sure to adhere to the disease control measures. Reproduction level for reinfection across the entire country is maintaining at less than 1. So it was less than 1, which was a decrease compared to the previous week. For the metropolitan area, there was almost no change, and we're seeing that the spread is becoming more stagnant. And when we go into the details, there are continuous cases happening in many of our daily lives. First of all, manufacturing areas and call centers, which are confined and concentrated and also closed, we see many newly confirmed cases. And there are also cases coming out from the gatherings and sports facilities and other indoor facilities. Therefore, we are seeing these cases in our communities. So we are seeing that the number is not exactly increasing, however, it's not decreasing either. However, starting from the middle of January, for the past 7 weeks, we have seen 300 to 400 newly confirmed cases on a daily level. Therefore, we cannot be complacent. And we cannot be at an end until we are completely at an end. Therefore, we have to make sure that we are always vigilant. At the end of last month, and at the end of last year, actually, we have seen the case where the newly confirmed cases surged from 400 to 1,000. Therefore, we have to be always cautious. We hope that we'll be able to stabilize the situation. Now, I will update you on the monitoring situation for the business sites where foreign laborers are working in. We have seen a lot of cluster outbreaks in those cases, and in order to make sure that there is no reinfection, we are taking measures. Ministry of Labor is working together with the regional authorities, and we are doing a stricter monitoring on business sites with foreign workers, and we are doing site monitoring especially for those areas with dormitories. And there were 1,600 risky sites in the metropolitan area and in the nearby areas. Therefore, we're going to analyze by getting samples from the environment as well. And if we find COVID-19 being found, then we're going to ask the workers there to get tested for COVID-19. The site monitoring is monitoring situations like wearing a face mask, ventilation every 2 hours, having a blocking material in between people when they're eating, and etc. And for those that are vulnerable, they would have to report to the regional institutions and they would have to get tested for PCR, and this is the measure that we're going to take action with. In closed situations where there are a lot of people who are concentrated, then it is especially risky, and the only way to prevent any spread of infection would be to strictly follow the measures on disease control. So we want to ask all the employees and the employers to strictly adhere to the disease control measures so that we do not see a cluster outbreak. Now I will explain about the countermeasures against the third wave of COVID-19. With the increase in movement with the spring season, there is a higher risk of COVID-19, and there is a possibility that we could see another resurgence of COVID-19. And across the world, there are mutant viruses, and even in Korea, there is a risk that these mutant viruses could spread at any time, and many experts are also concerned about this. Therefore, in order to prevent this and in order to make sure that there is no fourth wave of COVID-19, the government is taking measures, and in order to prepare it, it is strengthening measures and it is also strengthening its disease controls. So in order to prevent the fourth wave, we are going to first strengthen our disease control measures. We are going to expand the preliminary testing for COVID-19 so that we can find the patients in advance. And we're also going to apply the test as necessary. And for the long-term care facilities and correctional facilities that are especially vulnerable, we're going to make sure to have regular testing so that we can decrease the risk of cluster outbreak. In addition, there are the lay people without symptoms, so we're going to expand the screening centers so that these people and civilians can be tested as well. And we're also going to supplement the epidemiology researchers so that we can actually analyze these things very quickly. And by doing this, in parallel with it, we're also going to provide the support businesses so that we can strengthen the capability as well. Also, we're going to use the epidemiology information so that we can do sample testing in order to prevent cluster outbreak in advance. And in order to prevent the mutant viruses, for those countries that are especially vulnerable to these mutant viruses, we're going to be monitoring the people who are entering from these countries especially more carefully. So everyone would have to submit test results, and we are actually carrying out 3 PCR results for these people from before and after the entrance of the country. And for the isolation, instead of doing that, we're also going to have 3 cases of PCR. So we're going to strengthen the management situation as well. And if there is a resurgence, we're also going to prepare for it. Therefore, we're going to prepare our medical personnel and medical supplies. Right now, we have 760 hospital beds for COVID-19 patients, and including that, we have secured 16,000 hospital beds. And we can use 11,000 hospital beds right away. That means that we can respond to around 1,000 newly confirmed cases in a day. And we're going to secure more hospital beds so that we can respond to cases of 2,000 patients per day if there is a resurgence. And we are also going to gather more nursing and medical personnel so that we can be fully prepared for all of our medical system, including the medical supplies. For the past year, we have gathered experience for COVID-19, and we have also strengthened our medical system. And we have also made some measures on social distancing, and we are preparing to amend this as well. So even when we are complacent, we have to be always vigilant, and we have to be prepared for risky situations. And the government is taking efforts to respond to another mass outbreak if there is one. So we want to make sure that our citizens come back to their daily lives as soon as possible. So we're going to strive hard to do so. Thank you.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time.